For a long time, I did not want to become a physician. I wanted to become a biologist. I was greatly interested in biology. At one time, I was carried away by ornithology. I used to ring birds. I watched how it all happened. In summers, I used to frequently go to places where birds were watched and ringed. I liked it immensely. During the last grade of secondary school, I don't even know whose influence it was, either that of books or relatives. I decided, however, to become a physician, and I devoted all my time to it. To my mind, a physician's mission is to be the conscience of society. It usually pastors who take care of people's spiritual life. Yet the physician also represents in a way people's conscience. The demands on a physician's moral standards are very high. And another thing is that I like to do something with my hands. I cannot sit the whole day in my office and write prescriptions or fill out medical cards. I like to work with my hands so I could immediately see the result of my work. In surgery, often happens that you can see the result right after you have operated on a person. Most often I operate on joints, and I like my work very much. In general, I like to work with healthy people who have only damaged joints, but who are themselves healthy and active. Many of my patients are athletes, and the physician does surgery only on the injured limb. But the person himself is mentally and physically healthy. With him, everything else is in tip-top shape. It is immensely gratifying to do just one definite thing and see the person well again. Maybe it sounds very self-confident, but I like the fact that the result or the effect is, so to say, palpable. And it is very important to follow the things happening in the world, since everything depends on small things. People often do not pay attention to these things, but in reality, the nuances, the small things we do during surgery are most important for the patient to feel well afterwards. A person may think it is all the same who operates on his injured limb or where the surgery takes place, since knee arthroplasty seems such a simple operation. The main thing for the patient is that the surgery should be cheap. However, an amateurish surgeon may mess everything up and the patient may remain a cripple till the end of his days. That is why, the more you work, the deeper you get into the thing. People do not get as much pain as some 10 or 15 years ago when I operated on them. It can be compared with piano playing. The more you practice, the more you like it. The more skills you have and the better results you get. And it is pretty obvious. I often heard people say, he's all for gutting you up, he doesn't care for anything else. No, surgery is certainly not the only way to cure people. Each ailment has its own indications. The main thing is trust. If the person comes to you, he trusts you. That's how close relationships are formed. The conviction that surgery is necessary is based on a broad spectrum of things. The patient's complaints, the diagnosis, the surgeon makes, and finally the magnetic resonance imaging or further examination, which is only an additional method offering merely additional confirmation that surgery is needed. I'm very fond of traveling, mostly to mountains. Climbing mountains, trekking, or hiking along the mountain trails. I follow these things and usually choose the routes myself. For me, it's a relaxation from work. On holidays, you want to relax. On work days, each day is intensive. Your day starts early and ends late, and all the time you're deeply involved in your work. You operate, consult patients, meet your colleagues, discuss different problems. At the end of the week, you have a multitude of problems and impressions thrust upon you, and they're laying heavily as a burden on you. You know, a person may be a perfect craftsman who performs his work perfectly, operating on patients. This person may have skillful hands, and yet he may be only a craftsman. A good doctor needs a lot more. He must be a good person. A person whose moral standards are very high. Skillful hands are not enough.